Every 40 seconds, someone in the US has a heart attack, but many could have been prevented. It's a staggering statistic, and it's not just about numbers, it's about real people. Parents, siblings, friends, even you. What's even more alarming is that many of these heart attacks didn't come without warning. The signs were there. They just went unnoticed. These aren't dramatic TV-style chest-clutching scenes. The truth is far more silent and deadly. You won't always see someone gasping, falling to the floor, or shouting for help. In fact, most warning signs are subtle. So subtle that they're often mistaken for stress, fatigue, or even indigestion. That's what makes heart attacks so dangerous. Your body could be sending out red flags weeks in advance, and unless you know what to look for, you might miss the most critical window to act. Today, we're revealing the 7 most overlooked warning signs your heart is begging for help. These are the quiet clues your body whispers before a potential disaster. From unusual fatigue and sudden cold sweats to pain in unexpected places like your jaw or upper back, each sign tells a story, one that could save your life if heard in time. In this video, we'll break down each symptom, explain why it matters, and show you what to do if you or someone you love begins to notice them. Because when it comes to heart health, early awareness is your best defense. If you've ever thought, it's probably nothing, or brushed off persistent symptoms as just part of getting older, this video is for you. Stick with us, because understanding these 7 signs might just be the most important thing you do for your health today. Let's start with the most classic, but often misunderstood warning sign: chest pressure or discomfort. Now, forget the Hollywood version for a moment. A heart attack doesn't always hit like a bolt of lightning. In real life, it often begins quietly. Many survivors describe it not as sharp pain, but as tightness, a heavy squeeze, or like an elephant sitting on their chest. Take David, a 58-year-old accountant. He was sitting at his desk one morning when he noticed a strange pressure in his chest. Not painful, just uncomfortable. It was heartburn from last night's spicy takeout. But when the pressure started radiating to his shoulders and up to his jaw, he knew something wasn't right. He called 911, and doctors later confirmed he was having a heart attack. His decision to act quickly saved his life. And that's what we need to understand. Chest discomfort can be subtle. It may come and go, sometimes lasting just a few minutes. Other times it may feel like dull fullness or even mild discomfort you wouldn't normally associate with heart problems. It doesn't have to be severe to be serious. Women in particular may experience less obvious symptoms. For them, chest pain may feel more like pressure or burning rather than crushing pain. That's why so many cases go unnoticed until it's too late. So what should you do if you feel this? First, never ignore recurring or unexplained chest discomfort, even if it's mild. If the feeling lasts longer than 5 minutes or is accompanied by symptoms like shortness of breath, nausea, cold sweat, or pain in your arms, back, neck, or jaw, call emergency services immediately. It's better to have a false alarm than a late diagnosis. And here's a tip: keep track of any recurring chest sensations in a journal, including time, duration, tests, and associated activities. Share that log with your doctor. It could be a critical piece of your heart's story. Now, let's talk about a symptom that's often brushed off as just getting older: shortness of breath. But here's the truth: when you find yourself gasping for air during simple tasks like climbing stairs, getting dressed, or even just sitting still, your heart may be sending an urgent distress signal. Imagine this. Linda, a 64-year-old retired teacher, started noticing she was winded after folding laundry. At first, she thought it was allergies or maybe just being out of shape. But one afternoon, while watering her plants, she had to sit down because she felt like she couldn't catch her breath, even though she wasn't doing anything strenuous. That subtle change, it turned out to be a sign of congestive heart failure. Shortness of breath occurs when the heart can't pump efficiently. As a result, fluid begins to back up into the lungs, making it harder to breathe. You might feel like you just ran a mile, when all you did was walk across the room. And it's not just about breathlessness during activity. One of the biggest red flags: waking up at night, gasping for air, or needing to prop yourself up with pillows to sleep. That's a classic sign your heart is struggling to keep up. This symptom is often more common in women and may show up without chest pain. That's why it's so often missed. especially in the early stages. So, what can you do? If you notice frequent breathlessness, especially during light activity or rest, don't chalk it up to age or lack of fitness. Track how often it happens, what you were doing, and whether it's getting worse. Make an appointment with your doctor and ask for a complete cardiac workup, including an echocardiogram to check how well your heart is pumping. And if your breathlessness is sudden, severe, or accompanied by chest pressure or dizziness, call emergency services immediately. Shortness of breath may seem small, but it's often the first visible sign that your heart is overwhelmed. Don't ignore it. Your breath is your body's most basic signal, and when it's out of rhythm, it's time to listen. Let's be honest, everyone feels tired now and then. But there's a difference between normal tiredness and the kind of fatigue that feels like your body is running on empty, even when you've done next to nothing. Picture this. Maria, a 62-year-old grandmother of 4, always loved her morning walks. But over a few weeks, something changed. She started feeling drained just walking from her bedroom to the kitchen. Climbing the stairs, it felt like scaling a mountain. No fever, no cold, no big changes in her life, just a heavy, bone-deep exhaustion that wouldn't go away. Her doctor initially chalked it up to stress or menopause, but days later Maria was rushed to the ER with a heart attack. Fatigue is one of the most overlooked warning signs of heart disease, especially in women. It doesn't come with fireworks or dramatic pain. It sneaks in slow and quiet. Many women report feeling off weeks before a heart event, tired doing simple tasks, needing more naps, or struggling to concentrate. And here's the scary part. This type of fatigue is often brushed off by doctors, family, and even by ourselves. You're just getting older. Maybe you need more sleep. It's just stress. But persistent, unusual exhaustion that lingers for days or weeks, especially when paired with other symptoms like shortness of breath or dizziness, may be your heart whispering for help. What should you do? First, listen to your body. If you're getting winded or wiped out by tasks that never used to challenge you, don't ignore it. Keep a journal. Jot down when the fatigue happens, what you were doing, and if anything helps or worsens it. Second, bring it up with your healthcare provider and be specific. Mention the duration, intensity, and any accompanying signs. Ask for a cardiac evaluation, especially if you have any risk factors like high blood pressure, diabetes, or family history. Lastly, prioritize heart-healthy habits. Eat well, move gently but regularly, and manage stress levels. But most importantly, trust your instincts. If your energy disappears and doesn't come back, it's time to get checked. Unusual fatigue isn't laziness, and it's not just life. Sometimes it's the calm before a storm, and catching it early could save your life. Now let's talk about a symptom that creeps in like a thief in the night: cold sweats and sudden dizziness. Imagine you're sitting at the kitchen table, sipping tea, and suddenly your skin turns clammy. You feel lightheaded, like the room just tilted slightly. You wipe your forehead, surprised to find beads of sweat even though you're not hot. You haven't exercised. You're not nervous. There's no obvious reason, but something doesn't feel right. That's exactly what happened to Paul, a 58-year-old accountant. One morning, while tying his shoes, he suddenly broke out in a cold sweat and felt like he might faint. He dismissed it as low blood sugar or maybe stress, but later that week, he ended up in the emergency room with a blocked artery. That sweat wasn't random. His heart had been quietly waving a red flag. Cold sweat and dizziness are tricky. They're often chalked up to menopause in women or anxiety in both men and women. And while those causes are certainly real, so is the risk that your heart may be struggling to circulate enough blood and oxygen, especially to the brain. When the heart's output drops, blood pressure can fall, causing that lightheaded sensation, and the body breaks out in sweat as it enters a state of alarm. Here's where it gets serious. These symptoms often appear minutes, days, or even weeks before a heart attack. They can strike while at rest or during mild activity. And when paired with other signs like fatigue, shortness of breath, or chest discomfort, they should never be brushed aside. So what should you do? First, track the pattern. If you experience unexplained dizziness or sweating more than once or in combination with other symptoms, even subtle ones, see your doctor immediately. Second, don't self-diagnose. It's easy to blame hormones, dehydration, or low sugar. But if your gut says, This feels different. Listen to it. Medical professionals can run a simple EKG, stress test, or blood work to check your heart function. Third, prioritize prevention. Maintain a healthy weight, stay hydrated, manage blood pressure, and get regular checkups. Even something as simple as improving sleep or reducing caffeine can stabilize blood pressure and reduce dizziness. Remember, your heart doesn't always scream. It whispers. Cold sweats and dizziness might be its quiet plea for help. Catching it early could be the decision that saves your life. You might not expect a heart attack to feel like a stomachache, but for many, that's exactly how it starts. Picture this. It's just after lunch. You feel a strange tightness in your upper belly, maybe a little bloating, a touch of nausea. You pop an antacid assuming it's heartburn or something you ate. But the discomfort lingers. It doesn't spike into intense pain, and it doesn't exactly go away either. You shrug it off, chalk it up to stress or bad digestion. That's what Lisa did. Lisa, 63, had just retired. One afternoon, while walking her dog, she felt waves of queasiness and slight upper abdominal pressure. It felt eerily like indigestion, but nothing she ate seemed to cause it. She ignored it for 3 days, until she collapsed in her driveway. What she dismissed as simple digestive upset was actually a warning sign she was having a heart attack. Here's the surprising truth. Nausea, stomach discomfort, or what feels like heartburn can actually be cardiac in origin, especially in women. Why? Because the nerves that relay pain from the heart can refer that pain to the upper stomach area. The result is a sensation that's easy to misinterpret, particularly if you're not feeling the classic chest pain or arm numbness. Studies show that up to 40% of women who experience a heart attack don't feel chest pain at all. Instead, they report nausea, indigestion, lightheadedness, or fatigue. In fact, women are twice as likely as men to present with gastrointestinal symptoms during a cardiac event. So how do you tell the difference? Pay attention to patterns. If the nausea comes on suddenly, lingers, or is paired with cold sweats, fatigue, or dizziness, don't ignore it. Look for what's missing. If antacids or rest don't help and there's no obvious food trigger, your heart, not your stomach, might be the culprit. Act fast. If you're over 50, have risk factors like high blood pressure, diabetes, smoking, or a family history of heart disease, get checked immediately. A simple ECG or blood test can rule out a cardiac cause, and if it is heart-related, early intervention could make all the difference between recovery and tragedy. Bottom line, indigestion doesn't always mean spicy food. It might mean your heart is crying out for help. Listen closely, especially when the signals feel subtle but stubborn. Now, let's talk about a signal that often feels more annoying than alarming. Numbness or tingling in your arm or hand, especially on the left side. It might feel like your arm fell asleep, like when you rest awkwardly on it. But what if it happens out of the blue? No pressure, no obvious reason, and keeps coming back. That's when you need to listen up, because in some cases that numbness isn't about nerves, it's about your heart. Meet James, 58, a construction foreman, strong, tough, never the type to complain. Over a few weeks, he noticed that his left hand would occasionally go numb while driving. He brushed it off as fatigue, but then it started happening at rest, while watching TV, even waking him from sleep. No pain, just a strange, creeping numbness from his shoulder down. When he finally went in for a checkup, doctors found significant arterial blockage in his coronary arteries, a heart attack waiting to happen. The symptom is linked to something called peripheral arterial disease, PAD, or maybe referred pain from narrowing in the coronary arteries. When your heart doesn't get enough oxygen-rich blood due to leakages, it sends out distress signals. And the left arm is a classic location because the way the cardiac nerve pathways are wired. Here's the catch. Numbness doesn't always come with chest pain. It may feel mild, or you might blame it on posture, poor circulation, or arthritis. But if it happens repeatedly without a clear reason, lasts longer than a few seconds, or shows up with fatigue, cold sweats, or shortness of breath, then it could be your heart whispering before it screams. So what should you do? See a doctor and describe exactly when and how the numbness occurs. Get a cardiovascular evaluation. An ECG, blood tests, or a stress test can help uncover blockages before they become life-threatening. Know your risk factors. If you smoke, have high blood pressure, diabetes, or high cholesterol, your chances of arterial blockages are significantly higher. The earlier you act, the better your odds of preventing a heart attack. Numbness may seem like nothing until it's everything. And yet, despite how dangerous these warning signs are, most heart attacks don't begin with a dramatic collapse. In fact, they often sneak in quietly, disguised as something ordinary. That's the first reason so many people miss them. They're silent, or at least subtle. A bit of indigestion here, a strange heaviness after walking upstairs, maybe some random jaw tightness or lightheadedness. Most of us chalk it up to stress, age, or being just out of shape. And by the time the symptoms grow louder, it may already be too late. This is especially common with signs like unusual fatigue, shortness of breath, or cold sweats. Because they're not dramatic or specific, people wait, they rest, they push through. They delay calling for help, not realizing they're already in the early stages of a heart crisis. But there's another layer to this problem: our cultural mindset. In America especially, we've been taught to tough it out. Feeling tired, keep going. Achy chest, just take an antacid. Many people wear fatigue like a badge of honor. They put off doctor visits, downplay discomfort, and minimize symptoms. This mindset, especially among working adults, caregivers, and men in high-demand roles, leads to misdiagnoses and preventable emergencies. Take John, a 58-year-old truck driver. He'd been experiencing chest tightness during long drives, but assumed it was due to poor posture or lack of sleep. He brushed it off for weeks. Only after pulling over one day with crushing fatigue and dizziness did he finally seek help. Doctors found a near-total blockage in a main coronary artery. He was lucky. His story is not rare. It's a red flag for the rest of us. And then there's one of the most critical and often overlooked reasons symptoms go unnoticed: gender differences. Heart disease doesn't always play by the same rules in men and women. While men often report classic symptoms like sharp chest pain radiating down the arm, women frequently experience subtler cues: nausea, indigestion, fatigue, or even back and jaw pain. They may never feel any chest discomfort at all. This silent presentation causes many women, and even healthcare professionals, to miss the warning signs entirely. Consider Maria, 62. She started feeling overwhelmed by fatigue and back pain. No chest pressure, no arm tingling. She thought it was a bad week. Even when she told her doctor, her symptoms were brushed off. Only after going to the ER days later did she learn she had already suffered a mild heart attack. She got lucky. Many don't. So how do we fix this? Raise awareness that heart attack symptoms are not always obvious or textbook. Trust your instincts. If something feels new, persistent, or off, it's worth investigating. Don't delay. If symptoms come with risk factors like being over 50, postmenopausal, diabetic, or having a family history of heart disease, get checked now, not later. Because here's the truth: listening to your body could save your life. These signs might seem easy to miss, but now you know what they mean. And that gives you something priceless: the power to act. Stay with us, because in the next part, we'll talk about what to do when these signs appear. Your response time could be the difference between recovery and tragedy. So, now that you know what to look for, what should you do if your body starts whispering or shouting these warning signs? First and foremost, don't wait. This isn't a moment to be brave. It's not the time to Google your symptoms or sleep it off. When it comes to the heart, time is muscle. Every minute of delay could mean more damage to your heart tissue, and the difference between a full recovery and lifelong complications. If you're experiencing persistent or intense symptoms like tightness in your chest, shortness of breath, cold sweats, or unexplained fatigue, call emergency services immediately. Don't drive yourself. Don't try to walk it off. Let paramedics monitor you from the moment they arrive. They can provide life-saving care on the way to the hospital. Now, maybe your symptoms aren't full-blown. Maybe they're subtle. They come and go. You're not sure if it's stress, poor sleep, or something more. That's where the power of early screening comes in. If you're over 50, have high blood pressure, diabetes, a family history of heart disease, or you've been feeling off, ask your doctor about getting an ECG or a stress test. These non-invasive tests can detect irregularities in how your heart functions, even before a heart attack occurs. Let me tell you about Frank. He's a 62-year-old grandfather who just wanted to keep up with his grandkids. Lately, he felt winded after climbing stairs, but blamed it on just getting older. His daughter insisted he see a doctor. One ECG later, they discovered he had heart-silent ischemia, reduced blood flow to the heart, without typical symptoms. A stent and a lifestyle overhaul later, Frank's now out biking every weekend. Early action changed everything. And let's not forget the daily habits that can literally save your heart. Eat smart, cut down on ultra-processed foods and excessive sodium. Load up on fiber, omega-3s, and heart-healthy fats like olive oil. Move your body. Even a 30-minute walk 5 days a week lowers your risk. Stress less. Chronic stress puts your heart in overdrive. Breathe, meditate, unplug. Sleep better. Poor sleep increases your risk for hypertension and arrhythmias. Aim for 7 to 8 hours a night. Your heart is talking. Are you listening? Because recognizing the signs is just step one. Taking action, that's what makes the difference. And now that you know how, you're not only protecting your future, you might even save someone else's. So here's the truth most people miss. Your heart doesn't shout, it whispers. It speaks in subtle signs. Tightness that comes and goes, breathlessness while doing the laundry, fatigue that's just a little too much to explain. It's easy to brush off, easy to delay. But sometimes that delay is the difference between prevention and a crisis. You don't need to wait for a siren moment to take action. In fact, the best time to protect your heart is before it ever breaks. Before the emergency room, before the regrets. And that starts with one thing: listening. Listening to the quiet nudges your body gives you. Listening to the science. And yes, listening to videos like this that are here to guide you. So, if this message struck a chord, if you learned something today that made you pause and think, please hit the like button, subscribe to the channel, and share this video with someone you love. Because awareness is the first step, and sharing it can truly save a life. We've got more powerful heart health content coming up. Everything from nutrition to stress relief to cutting-edge prevention tips. All right here on Senior Health Source, your trusted guide to aging well and living strong. Take care of your heart. It's the only one you've got.